To understand the difference between Cologuard and a colonoscopy, I think you have to step back a little bit and understand what screening is. Screening for colon cancer can be based on two different ways. One is stool-based, and up until very recently that was checking for blood in the stool. Or the newest one now is this Cologuard, which is based on shedding DNA. If you have cancer and it has mutations in it, then the DNA that is shed in the stool on a regular basis from it will look abnormal, and that can be picked up. The focus of screening, at least by many societies like the American College of Gastroenterology, is to recommend colonoscopy first because you can prevent cancer. And only in instances where, despite that, and proper education of the patient occurs, explaining to them the difference between preventing cancer and finding it, if those people still are very, very reluctant to have any kind of colonoscopy screening, then certainly we should offer them any modality to screen for cancer, and that would include Cologuard and also checking for blood in the stool, so-called fecal immunochemical testing. Colonoscopy is what's called a structural optical test. You're actually looking directly at the colon. In doing that, you're going to find more than 90%, actually more than 95% of colon cancers. But on top of that, you're looking, and this is important, you're looking for the precancerous lesions, so-called polyps, that will have the potential in most cases to become a cancer. Conversely, if you have nothing on colonoscopy, if there are no polyps there at all, then the next colonoscopy, the interval is 10 years from now. And that's been studied based on the biology that it takes roughly around that time for polyps to become cancers. So you can feel comforted when you have a negative colonoscopy that you don't have to worry of developing a colon cancer in the next 10 years. The good news is that colon cancer deaths have come down over the last 20 years, and that the rate of development of colon cancer in the population, so the so-called incidence, has also come down, which is attributed generally to colonoscopy. The other good news is that if you can't have a colonoscopy or won't have a colonoscopy, there are modalities that are now able to be recommended that are very, very good at finding cancer, and to a certain degree also preventing it, because at least the larger of the polyps can be picked up roughly half of the time.
Griffin Health, empowering people, advancing care.